Mr. President, I spoke on the Neil Gorsuch nomination last week, and I intend to speak again on it tomorrow. Let me just say that I support Neil Gorsuch as the nominee to the Supreme Court. He's a good man. He's a mainstream jurist, incredibly qualified, and I'm happy to strongly support him for the court. But tonight I want to talk about another issue, one that I hope can continue to bring us together here in this body, and also bring our country together. I rise today to talk about what a lot of experts say is the worst drug crisis in the history of our great country. The worst. It's the opioid epidemic. This is the addiction to heroin, prescription drugs, synthetic heroines like fentanyl. The newest threat, this synthetic fentanyl, is coming into our communities from countries, particularly China. There are laboratories in China where evil scientists are putting together these concoctions and sending them through the U.S. mail system into our communities. China is doing it on a scale that is devastating to our communities. As a result, I have urged President Trump to prioritize this issue in his meeting with President Xi in Florida later this week. China has banned one synthetic form of heroin, carfentanil, recently, but there's a lot more to do. And I'm urging President Trump to make it clear to President Xi that we will do everything we need to do to keep this poison out of our communities. This epidemic, Mr. President, is affecting every single one of the states represented here in this body. I know the presiding officer knows that because I know he's been involved in his own state. It's affecting your hometown. Whoever you are, wherever you are in the United States, unfortunately, it's affecting people you probably know. Every day we're now losing 144 Americans to drug overdoses, most of which are from overdoses of opioids. That's one American life lost every 12 minutes. That'll be about the length of this speech. Look at your watch. In the next hour, 5 Americans will die of a drug overdose. I've been working on this issue for a long time. I first got involved over 20 years ago when I was in the House of Representatives, and a constituent came to me because her son had died of a combination of smoking dope and huffing gasoline. She came to me and said, "What are you doing about it?" I was ready. I talked to her about the fact that we had $15 billion devoted to interdicting drugs and incarcerating people and so on. And she said, "What are you doing to help me in my community?" I've gone to my church. They're in denial. I've gone to the school. They say it's not a problem here. I've gone to my neighbors. They won't come together and talk about it. So we got involved in this issue, and I set up our own community coalition back in my hometown of Cincinnati. Chaired that for 9 years. I'm still very involved with that group. But also got involved in legislation to try to do things to actually reduce the demand for drugs, because that's so important. Here we are again. The crisis we had then was mostly crack cocaine, marijuana. Then it was methamphetamines, bath salts. But I've never seen anything like this. This is the worst. If you don't think it's the worst drug crisis we've ever faced, then think about this. Look at this chart. Drug overdose deaths in America. Drug overdoses are now the leading cause of accidental death. The leading cause in my home state of Ohio, and probably in your state and in our country. This is from 2015, the most recent year for which we have complete data. Nearly 2/3 of the deaths were because of this prescription painkiller, heroin, fentanyl issue, synthetic forms of heroin. Drug overdoses are not now just the leading cause of death. Overdoses kill more Americans than guns do. This next chart will show that, according to the Centers for Disease Control and Prevention, more Americans died from drug overdoses in 2015 than died from AIDS, HIV/AIDS, at the height of that epidemic. The peak of the AIDS epidemic was 1995. This is 2015 with regard to drug overdoses. According to an article in the New York Times, more than 4 times as many people are dying every day from this epidemic than were dying at the peak of the crack epidemic. In the last 3 years, more Americans have died of drug overdoses than died in the Vietnam War. Unfortunately, we've got reasons to believe that this crisis is getting worse, not better. According to recent figures, fatal overdoses due to prescription painkillers, heroin, or synthetic heroin in 2016 alone went up 26% in Connecticut, 35% in Delaware, 39% in Maine. During the first 3 quarters of 2016, deaths from overdoses in Maryland increased 62%. In Ohio, they increased 20% the last 2 years in a row. So we've seen this huge spike here in deaths from overdoses, starting in about 2010 and going up. This is with regard to heroin. This is with regard to non-methadone synthetic opioids, in other words, fentanyl, carfentanil, U4, and other synthetic heroines. This is a crisis, and it's one that unfortunately is affecting every single community, whether you're in an urban, suburban, or rural community, whether you're young or old, regardless of your walk in life. The issue, of course, is much bigger than just the tragedy of overdose deaths. It's also about people whose lives have gotten off track because of these drugs and because of the addiction. There are 200,000 people in Ohio alone who are living with an addiction to these drugs. And by the way, if you are addicted, you are much more likely to be committing crimes like fraud and theft to pay for that habit. In my state of Ohio, and I bet in your state, the #1 cause of crime, opioids. A lot of these people have also lost a job or can't get a job. I talked to some business folks over the weekend in Ohio who talked about regulations and taxes, and they said, you know, this drug issue is affecting every single one of us. We can't get people to pass the drug test, and we have employees who are now addicted to prescription drugs or heroin, and their absenteeism and inability to come to work is affecting our economy. So this is something that is affecting all of us. Of course, many have broken relationships with their family and their loved ones. I can't tell you there are people who've told me, and I've probably met with 1,000 addicts or recovering addicts over the last few years. Can't tell you how many people have told me the drugs became everything and pushed my family out and pushed my friends out and pushed my job away and left me in a situation where I was broken. But living without hope is something that we can deal with because there are ways for us to get people into treatment and get people into recovery to help them. We're in a crisis, and some have asked me, well, how did we get here? Because that usually is a good start to how we get out of it. And how did we get here is complicated, but according to the Centers for Disease Control and Prevention, those who are addicted to prescription painkillers are 40 times more likely to be addicted to heroin. Let me look at this a different way. 4 out of 5 heroin addicts started with prescription drugs. So this issue of prescription drug overprescribing is a huge part of how this happened in the first place. And increasingly what we've seen in all of our states is addiction starting with these drugs, then switching to cheaper and more accessible heroin, then switching again to sometimes more powerful forms of heroin like carfentanil, maybe 30 to 50 times more powerful than heroin. And that's what's taking so many lives at such an alarming pace. The epidemic started with overprescribing. The United States uses more prescription painkillers than any country in the world, and it's not even close. Look at these numbers here. This is the daily opioid dose for over 1 million people. Look at the United States as compared to every other country in the world. This is using 2014 data, and the numbers may have gotten better because of the work being done to cut back on painkillers. But according to the American Society of Interventional Pain Physicians, we consume nearly 70% in this country, 5% of the world's population, nearly 70% of the world's painkillers, even though we're not even 5% of the world's population. In 2012, that number was 75%. So it's also not even close on a per-person basis. For every American, there are 50 pain pills in this country. Second place is Canada, with 30 pain pills. According to the National Institute on Drug Abuse, painkiller prescription sales nearly quadrupled from 1999 to 2014. That number finally peaked in 2012, by the way, and since has come down slightly. In 2012, there were more prescriptions for painkillers in Ohio than there were people in Ohio. More prescriptions for painkillers, not pills, prescriptions, than there were people in Ohio. By the way, it was also true in 11 other states. Fortunately, in Ohio, we have made some progress under the leadership of Governor Kasich, Senate Governor Mary Taylor, the Attorney General Mike DeWine, our legislature. We've taken some important steps to cut back on the painkiller prescriptions. We've cut them back by about 1/5, about 20% since they peaked in 2012, but the number is still way too high. According to the Ohio Board of Pharmacy, 631 million pain pills were prescribed to Ohioans last year. We're still dealing with the consequences also of a lot of the addictions that got started in 2011, 2010, or before. The number of prescriptions has risen just as the addiction to opioids has risen. And drug cartels have followed this prescription drug epidemic, bringing in heroin. Those drug cartels have flooded my state and probably flooded your state with this cheaper, more accessible heroin, and now synthetic heroin. According to the National Institute of Drug Abuse, Mexican heroin production alone increased 6-fold in just 4 years, from 8 metric tons in 2005 to 50 metric tons in 2009. That number is now 70 metric tons, and it just keeps rising. According to the Office of National Drug Control Policy here in this country, Mexican opium poppy planting increased by 64% just from 2014 to 2015. So it's getting worse, not better. According to the Congressional Research Service, by the way, virtually all of the heroin produced in Mexico is consumed here in the United States of America. According to the Centers for Disease Control and Prevention, heroin use among young people has doubled in the last decade, among those young people 18 to 25 years old. And this affects all of us again. It knows no zip code. It certainly knows no walk of life. Since 2010, heroin overdose deaths have doubled among Hispanic Americans, African Americans, Native Americans, and whites. Just a lot of those people who are addicted to prescription drugs have switched to heroin, as we said. We're now seeing that heroin addicts are switching also. Even if they don't know they're doing it often, they're switching to these synthetic forms of fentanyl, like fentanyl and carfentanil. Again, can be up to 50 times more powerful than heroin. Sometimes they don't know it because the traffickers are sprinkling this fentanyl in other drugs. Heroin, of course, but also we know now cocaine, in mixing it with marijuana, mixing it with other drugs, not letting people know it. We had a 14-year-old girl recently die in Dayton, Ohio, who was snorting what she was told was heroin with her friends. She had done it before, but this was carfentanil or fentanyl, and killed her instantly. More than 1,000 Ohioans were killed by fentanyl in 2015, more than double the previous year, and more than 10 times the number in 2013. In Cleveland, for example, there have been more overdoses from fentanyl in the past 10 months than there have been in the past 10 years. More in the past 10 months than there have been in the past 10 years. In Columbus, there have already been half as many fentanyl overdoses in the first 3 months of this year as there were in all of last year. This is why I say fentanyl is the new risk, the new danger. And as one father told me who lost his son to an overdose, every time you engage in taking drugs, you are playing Russian roulette because you don't know what's in it. In my hometown of Cincinnati, fentanyl deaths now surpass heroin deaths. Drug overdoses in Cincinnati, by the way, increased by 40% just from 2014 to 2015. Over that same time frame, in just 1 year, heroin overdoses increased 12%, while fentanyl overdoses increased 153%. Mr. President, these numbers are really disturbing. They're discouraging, too, because it seems like we just can't turn the tide. It's easy to feel like we just can't do anything. We're paralyzed. But there's actually a lot we can do to help, and we can and should. Here in the Senate, we've taken some very important steps in the last year. About 9 months ago, we passed legislation called the CARE Act, Comprehensive Addiction and Recovery Act. We also passed last year the 21st Century Cures Act. Now, those two together provide much more funding for this issue. The Cures Act alone is $500 million more this year going back to the states to provide funding primarily for treatment for this increase in overdoses and deaths. $500 million again next year is also authorized. We've got to be sure that gets into the appropriations bills. We also have seen, I think much more importantly in a way, that through the Comprehensive Addiction and Recovery Act, separate legislation, that we're beginning to fund directly programs that work. We spent 3 years looking around the country, had 5 conferences here in Washington, D.C. We brought experts in from all over the country telling us what the best practices were. What's the best prevention technique that's working? How do we get kids not to make these decisions? What's the best thing that's happening in terms of treatment? And then longer-term recovery. What works, what doesn't work? Is medication-assisted treatment better? Is it better to rely more on longer-term recovery? Have you had more success there? All of this led us to put together this legislation, the Comprehensive Addiction and Recovery Act, that actually funds programs that work. Programs like drug courts that are working around the country, that take people, diverting them from prison and say, as long as you stay clean, you can stay out of jail because you're a user, you're not a pusher, but you've got to stay clean, and then providing alternatives, including using drugs that'll reduce the craving. If you reduce the craving for opioids, that's proven to be very, very successful in some cases. Vivitrol is the drug being used mostly in Ohio to do that. There's some great examples of people who have gone through the drug court process who have now been clean for a few years. They're back to work. They're back with their families. They're back as contributing members of society. So there is hope. We have seen how it can work. CARE is the first legislation Congress has ever passed to promote long-term recovery. Why? Because we looked around the country and had experts here. We figured out that the treatment programs are important, and before that, a detox program is important. But what is leading to more success is longer-term recovery programs. As an example, think about being in detox for a week and then maybe a couple weeks in a treatment program, and then going into a sober housing arrangement where you have regular meetings where you're getting support from fellow recovering addicts. That seems to work longer. You're there. It seems to work the better for most Americans. Unfortunately, we do not have all of CARA's legislation fully implemented yet. Only 3 of its 8 programs have been implemented. It's been a while. It's been about 9 months. It's time for us to implement all those programs. I pushed the Obama administration on this. I'm now pushing the Trump administration. Last week, I was delighted when the Trump administration announced the creation of a commission on the opioid epidemic led by New Jersey Governor Chris Christie, who's got a real passion for this issue. I want to commend the President and Governor Christie for their commitment to making progress on the issue. Their leadership, their partnership with Congress will make a difference. I talked to General Kelly, the new Secretary of Homeland Security, about this today. He's going to be on the commission. He said they're going to report within 90 days, report about the problem. We know a lot about the problem. We also have to be sure we're seeing some action. And what I would suggest today is that the administration work hard to implement the remaining 5 CARA grant programs that are not yet up and running. For example, it's been 8 months, again, 9 months almost, since CARA was signed into law, and yet we still don't have the grant for naloxone up and running. Our states and local communities need this, both to get Narcan on the street to save people's lives, because this is the miracle drug that reverses the effects of an overdose, but also to get more training for some of our first responders so they can administer it more effectively, particularly important right now with this new drug, this fentanyl, this synthetic drug coming in, because the synthetic heroin requires sometimes not 1, not 2, but 4 or 5 uses of Narcan, maybe more, to save someone's life. So our first responders are asking for this help. We still don't have the grant for medication-assisted treatment up and running. We still don't have the grant for pregnant and postpartum women's treatment providers up and running. This is helping us to ensure we have fewer babies who are born with this addiction. Let's get going on these. And for all of us here in Congress, let's be sure that we fully fund CARA. It's $182 million a year, every year, in addition to what we were spending on opioids. Let's be sure that funding is there, these programs are working, and that our communities begin to get more of the help that they need. These evidence-based programs that work are what we ought to be supporting, and that's exactly what the legislation does. I want to thank the Vice President. Vice President Pence was in Ohio on Saturday, and it was a meeting about the economic issues we face as a country. He talked about tax reform and regulations and skills training, but he also talked about this issue. And I think it's important that we're all talking about this issue back home, to raise the awareness, hopefully to save lives, keep people from going down this path, but also to ensure that our fellow citizens know the importance of Congress and state legislatures and local communities getting engaged and involved. Everyone must get involved. I was in Youngstown, Ohio on Friday, held a roundtable at what's called the Neil Kennedy Recovery Center. This is one of the first programs of its kind in the country. It started in the late 1940s, actually, focused more at that time on alcoholism. Executive Director Carolyn Givens was there with her staff, incredibly compassionate people, told me a lot of stories. I was able to meet with some of the recovering addicts at the center. One told me, his name was Michael. He told me that that center saved his life, saved his life. This is a guy who worked for years for utility companies. He was a skilled worker. He got involved with prescription drugs. Often it's because of an accident or an injury. And then he ended up moving to heroin, cheaper, more accessible, and found his life spinning out of control. Now he's there. He's getting back on track. Everybody, by the way, at the round table who was there, and it was the staff, it was community leaders who were involved in this issue, they all said, get this legislation implemented. We need it. On Friday afternoon, I went to Cleveland and toured the St. Vincent Charity Medical Center with addiction specialists. One was Dr. Ted Perrin. What an amazing guy he is. This is in a hospital setting where they have a detox unit and a treatment center. Very unusual. I think it's the only one of its kind in Cleveland. And it's one of the few in the country where within a hospital setting, these people are getting everything they need. It's a very comprehensive approach. They deal with mental health issues, of course, but also other physical issues people have, which is helpful to have it all together there at that center. I thank the sisters for what they're doing, because they're supporting this, and sometimes it's quite expensive to have a treatment program. But at St. Vincent's, they're doing an awesome job. Everyone told me the same thing there that I hear across Ohio, that their services, unfortunately, have never been in greater demand. They've got a waiting list. Situation's getting worse, they say, not better. I think that's true in your state, too, because according to the Substance Abuse and Mental Health Administration, SAMHSA, 9 out of 10 of the 22 million Americans who are suffering from addiction are not getting the treatment that they need. 9 out of 10. CARA and the Cures Act will help change that. People need to change that in their own hearts. They need to step forward and seek the treatment they need. We need to take away the stigma of this addiction because it's an illness. We need to treat it as an illness because that will help get people to come forward, admit they have a problem, and get into the treatment that they need. Their families and their communities are desperate for that to happen. CARA and Cures, again, will help change all that, and I applaud my colleagues here, Republican and Democrat alike, for moving forward in this legislation over the last year, but there's a lot more work to do. We should continue to address the underlying issue of overprescribing that started this epidemic in the first place. We talked about this, the number of prescriptions that are still out there. Last week, I joined with my colleague, Senator Amy Klobuchar, to introduce bipartisan legislation called the Prescription Drug Monitoring Act to keep better track of prescription painkillers, to keep them out of the wrong hands, and to identify an addiction as early as possible so it can be treated. This goes to pharmacists who have to report when somebody gets a pain pill prescription. They have to put it on the prescription drug monitoring program. It goes to doctors. They have to be sure that when they are prescribing medication that's part of the drug monitoring program, and they have to access the drug monitoring program before they give a prescription to be sure the person isn't filling a prescription with them. They've already filled somewhere else because, unfortunately, there's a lot of that abuse still out there. Sometimes it's across state lines, which is why federal legislation is required, because our legislation requires that states work better together to be sure the prescription drug monitoring programs are talking to each other. And by the way, if people don't do this under our legislation, the pharmacists, the doctors, the states, then they have their federal funding pulled back that we talked about earlier under the CARA legislation. If you see a sign of addiction starting, our legislation requires that you let the patient's doctor know that, so we can begin to identify people who have an addiction, and we can get them into the treatment that they need. I think this is going to be a good bill because it will lead to a smarter and more effective use of taxpayer dollars. And more importantly, of course, it's going to prevent a lot of new addictions from starting in the first place. That, of course, will save lives. Congress, though, can also do something else that's really important, and that's to give law enforcement better tools to be able to keep some of this poison out of our communities. So the prevention and the treatment and recovery and Narcan for our first responders, all really important. But let's also keep some of this out. Let's do a better job of stopping the heroin at the southern border. Let's do a better job of stopping the fentanyl. That's this new synthetic heroin we talked about that's causing so many overdoses and deaths. Let's do a better job of keeping that out. Now, this should be a no-brainer, in my view, because it's coming in through the U.S. mail system. We know this. All the studies show this. Most of these synthetic drugs are being made in labs in China and then shipped by mail to traffickers in the United States, sometimes to Mexico as well. Typically, that is done through the Postal Service. Why? Because the private carriers, like UPS or FedEx or DHL and others, they require when you ship something that you have advance information provided to Customs and Border Protection and to others as to where the package is from, what's in it, where it's going. The post office doesn't require that. Any wonder the traffickers are using the postal system rather than one of these private carriers. Law enforcement came to us and told us that they could use this data. It's electronic data provided up front because that would enable them to determine the suspect packages of millions of packages that come into our country. They have to know how to find that needle in the haystack. That's why they want the ability to find these packages, to scan these packages, and to be able to stop some of this poison coming into our communities. The legislation we have with regard to this issue is called the STOP Act. I've recently introduced it again this year with Senator Klobuchar, Senator Rubio, Senator Hassan, and many others here in the chamber. It's a bipartisan bill called the Synthetic Trafficking and Overdose Prevention Act, the STOP Act. It closes this loophole we talked about in the Postal Service and requires the post office to obtain advanced electronic data on packages before they cross our borders, just like the private carriers have to do. It's not a new idea, by the way. In 2002, Congress placed this requirement on private carriers. That's when it started, and also required that the post office review this and look into this. So in 2002, this Congress was smart enough to say, this seems to make sense, let's require the post office to look into it. Well, we've seen the results. The results is traffickers stay away from the private carriers because they know they can use the Postal Service and get away with it. Traffickers are lacing the heroin on the streets of America with these synthetic drugs to make them stronger and more addictive. They're getting more people addicted. Fentanyl is also so powerful that it only takes a couple of milligrams, the equivalent of a pinch of salt, to kill you. They say 3 flakes can kill you. The fact that heroin is now being laced with fentanyl, of course, makes it much more likely not only to have an overdose because of the strength of this synthetic heroin, but also that you will die from that overdose. Again, it's much harder to use Narcan and begin to save lives by using that to reverse the effects of the overdose. So the STOP Act is, to me, again, it's something that we definitely ought to do in this chamber. It would restrict the supply of these dangerous drugs, it would raise the price of these drugs, and it would make them harder to get. That's going to save lives. Support for the STOP Act is growing. Our bill has now been endorsed by the Fraternal Order of Police, the major county sheriffs of America. They're convinced this tool will work. Last Friday, I was in Columbus, Ohio. I met with Franklin County Deputy Sheriff Rick Minard, also Deputy Chief of Columbus Police Mike Woods. We had the Cincinnati and Columbus directors of the Customs and Border Patrol. The chiefs were there to talk about it. We had Drug Enforcement Agency special agents in charge there with us. We also had people who are on the investigative side of Customs and Border Patrol. The Deputy Attorney General of Ohio was there, Steve Shoemaker, and others. All of them, all these law enforcement people said, we need this. Give us this legislation. It's a tool we need. We had a hearing today in the Homeland Security Committee, and General Kelly was there. Some of you know he's the new Secretary of Homeland Security. He agreed with me that the STOP Act would, and I quote him, help customs officers target illegal shipments, reduce the ability for the post office to be used for illicit shopping of all kinds of contraband, and be helpful to be able to identify packages. End quote. He's right. We need the administration's help and push for this legislation as well. Let's get this done. President Trump, by the way, endorsed this idea last year when he said during the campaign, quote, we will close the shipping loopholes that China and others are exploiting to send dangerous drugs across our borders into the hands of our own Postal Service. These traffickers use loopholes in the Postal Service to mail fentanyl and other drugs to users and dealers in the United States. The Trump administration will crack down on this abuse and give law enforcement the tools they need to accomplish this mission, end quote. Let's get it done. Again, I've asked President Trump to raise this issue with President Xi because China can do a lot more to try to shut down these laboratories in China, to try to stop some of the materials coming into the laboratories that make up this fentanyl. And by the way, it's in China's interest to do so. Now, I've received information recently that there's leakage. What does that mean? That means some of this fentanyl is going out into the countryside, into the suburbs of China, into the cities of China as well, and affecting their population. By the way, this legislation already has a companion bill in the House. So this is not an issue where the Senate can act and then we can't get it through the process because we can't get it through the House. The Senate, Pat Tiberi and Richard Neal have introduced companion legislation. Tiberi from Ohio, Republican, Neal from Massachusetts, a Democrat. It's bipartisan. It's the kind of legislation, again, that should draw bipartisan support, and we should get it done. Is it the silver bullet? No, we don't have a silver bullet. There isn't one silver bullet. There's a comprehensive approach here. But these two bills I've talked about are new steps that we should take. So, Mr. President, I urge my colleagues to continue to support the CARA legislation. Let's provide full funding. Let's support the CURES legislation in the upcoming appropriations process. Let's continue to engage the good folks back home who are trying at the tip of the spear to do all they can in terms of providing better treatment opportunities, better longer-term recovery, to go into our schools and talk about prevention, to do all we can to be able to keep people from going into that funnel of addiction. And let's pass this legislation. Join us in keeping better track of painkiller prescriptions so that potentially addictive drugs don't end up in the wrong hands and that addictions get treated early. That legislation is important. Join me and join the 10 other senators in pushing back against the poison of synthetic heroin coming into our communities by supporting the STOP Act as a co-sponsor so we can get this bill to the floor and get it to the President for his signature. I believe these two pieces of legislation, if allowed on the floor, would pass overwhelmingly. I believe the President would sign them. And most importantly, I believe they would begin to save lives in the communities we all represent. Thank you, Mr. President. I yield back my time.